and this is slated for tomorrow, the 2nd December. But of course, to look at the importance of this medical complex, we have here officials. To start off with is the Deputy Permanent Secretary of Admin and Finance there at the Ministry of Health, Madam Fanta Baisekas, just sitting right after next to me here. Thereafter, we have Dr. Momodu Tinyasi. Dr. Momodu Tinyasi is the Deputy Director of Health Services. Right after him is Dr. Buba Manjang. He is Director Public Health Services. We also have Mr. Hamadi Jawara. He's a community focal person for this particular project. We also have Jendak Jaju Kujabi sitting right next to Hamadi there. Jendak Jaju Kujabi is Regional Director, Western Region 2. We also have two other persons here who are focal persons from the communities, Ajemi Jata, as well as Hadindao, who will all join us subsequently to further look into this project. My name is Farato Mulushi, and I'll be the moderator for this panel. Thank you so much for joining us on this very important discussion because, you know, DPS, I'll first of all like to start with you to just maybe talk to us about the current state of our health care and why a complex like this is very much timely.
Thank you very much, Fatu, and good evening, viewers. Fatu, the complex is very much timely, as you are aware, when we had COVID-19 pressures, especially in the increase of cases, we were challenged. It was not really prepared for in the Gambia as well as in a majority of countries. And we have to battle to actually have specialized areas where we can provide treatment and services for the COVID patients. And this warranted the Minister of Health to really come back to table and say, yes, we need a special area where when we have emergency situation, we'll be able to address them. And this is the reason why we have a roadmap in which we are going to have this National Emergency Treatment Center, which we are starting with the first phase of the construction work, in which the Gambia government, in partnership, financial partnership with World Bank, will be constructing this state-of-the-art emergency treatment center, and will also be fully equipped as well. And there is also a waste treatment center as part of the package. And we have other facilities which doctors will come into it. However, this is the first phase of a 1,500 bed facility, which comes with a teaching hospital. This particular facility also will have a conference center as well. And this is all geared towards strengthening the essential health services in the Gambia.
I like the fact that he said it's going to be a one-stop, or I mean, from what I see, it seems as though it is going to be such a one-stop center for a lot of emergency services. And that brings me to, let me just start off with the Deputy Director before I go to the Director there, because we know that a medical complex consists of multi-system, operations or services, including complex treatment of intensive health care as well. Just what can we expect in terms of services?
Thank you very much, Fatu, and good evening, viewers. I'm going to be very brief as I can. Just to add up to what DPS mentioned, I just want to add a little bit, just to add a little salt to what he has mentioned. I'm sure a lot of viewers will start to question why a highly specialized teaching hospital at this moment, when we have already a teaching hospital in Banjul, Edward Francis Small Teaching Hospital. Just to make people understand, EFSTH was built in the early 50s, if I'm right, and it was not built to incorporate, it was not built as a teaching hospital. It was just built as a mere hospital. And as we are expanding, the capacity in EFSTH cannot accommodate highly specialized facilities that can be include to be a teaching hospital. And if you look at the geographical location of Banjul, to reach Banjul is very difficult. Just imagine traffic carrying a patient all the way from Bansam, Bassi, with the traffic jam to Banjul is very congested sometimes. That's why if you look at geographically, It's not, Farato geographically is not at the center, but if we put it at Farato, obviously the referral time will obviously reduce. And if you look at what we are spending on overseas treatment, annually is almost more than $30 million. And that is very expensive. And that's why under the visionary leadership of our able minister, he thought of this idea to build a highly specialized teaching hospital that will incorporate all what is needed to be called a one-stop center.
So what distinguishes this one from the EFSTH, which you said wasn't built to meet all the standards required for a teaching hospital? What is it in there that makes this one stand out?
If you look at EFSTH, it only have 4 departments: pediatrics, surgery, internal medicine, and obstetrics and gynecology.
Okay, speaking to the mic, please. Yeah.
Yes, and if you look at it, it's not what a teaching hospital should entail. A teaching hospital should include a broader specialties. Okay. That's why this highly specialized teaching hospital that we are building, the first phase will include what? A national emergency treatment center, a national observation treatment center, a national blood transfusion center, national public health laboratory and training center, imaging and diagnostic center that will include CT scan, MRI, ultrasound, X-ray. If you look at Banjul, they don't have what is called MRI, and they don't have other specialties. This is just the first phase, and this only include about almost 100 and something beds. But the intention is to build a highly specialized hospital that will contain 1,500 beds.
Okay.
And if you look at what is the next phase, we will have what they call cancer treatment center. That will, we are spending a lot of money for overseas treatment because of breast cancer, cervical cancer, and all those things.
Right.
Once we have all these things, this will, for radiotherapy, radiotherapy and chemotherapy will be here.
Okay.
And we are also going to have a pediatric unit that will contain about 100 beds. We're also going to have a pediatric surgical unit that will have 100 beds plus 5 theaters.
Okay.
And we're also going to have another 100-bed surgical unit, 100-bed medical unit. We'll also have other, so many things. If I name it, it's not going to.
I mean, we actually want to know, especially in just simple terms, what the services would be for those people who are anticipating. I mean, the ordinary people who are sitting there and are hoping. And I'm glad that you mentioned cancer, because now they know that something like cancer can be, treated in that particular center. What kind of other complexities, do we expect, especially that of intensive nature?
Yes. That's what I'm saying. I started with cancer. We will have also what we call a cardiology center. Okay. Those with cardiac problems will no more.
I mean, heart diseases. Okay.
Those with renal problems also will not be needed to go for overseas treatment. Also, other neurological problems will not be needed to pay a lot of money to ship them to overseas treatment. That's why this special hospital will include all these things. Okay. It's just that's why we call it a one-stop shopping medical center.
Hearing it, it's really pleasing to the ears. And let me just come
It's not going to be a one-day program. That's why we are taking it phase by phase. The first phase, as the PS mentioned, is going to include the first one we are in, which is already acquire funding.
Okay, let me put a stop to that and come to you, Director there, Director of Public Health Services. I understand that the project is very broad, and he mentioned it's in phases. We also visited some of your facilities, and we understand that you're also building a waste treatment center. Talk to us about the amount of clinical waste we see in this country, and why this particular center is very much crucial in curtailing that trend.
Yes, thank you very much, and thanks to all the viewers. I think this is crucial and very important at this moment that Minister of Health come up with such high-class facilities to be built at Farato. Looking at the clinical waste management in this country, in most of our health facilities, is it was a problem,
Okay.
and it's still a problem. So that's why under this World Bank funded project, under the leadership of Honorable Minister of Health, Dr. Ahmad Lamin Samate, he deemed it necessary for us to come up with modern high-class machines called the eco-sterile incinerators. These are automated and operated by microwave technology. This is waste, clinical waste in our facilities will be collected, and then the volume, if it is hundreds, it will reduce to 20%, and this will be sterilized, and then it will be decontaminated, and then disposed of at the normal dumping site without causing harm.
Where will it be disposed of? Have you identified like possible areas that would be no harm? Because we're talking about also environmental factors and hazards.
Yeah, we put all these things in place. We're working with NEA.
Okay.
All the steps that we take, we make sure that we go in for environmental impact assessment, and all these factors are captured. And then what we did is with support from NEA and also with hiring of consultants who did the assessments, come up with a report. And this report was submitted. It was submitted to NEA together with support from the Minister of Health.
Okay.
And this was validated with all stakeholders,
Okay.
relevant stakeholders. And the final report is produced. All these factors that you are looking at, we make sure that the machine is environmentally friendly, and the disposal site is also environmental friendly, not affecting anybody. But why we did is to protect our health workers, to protect individuals who visit the facilities, and to protect our community. That's why we want to take care of all these clinical waste, treat them at the center, and this involves 2 eco-sterile, that is 250 series, and also and 75 series.
So when you say you are protecting your officials or your staff as well as the public, in what terms do you mean you're protecting them again?
In the term of, because when you look at the clinical waste, health workers, health staffs are exposed when they are not properly handled.
Okay.
When they are not properly managed, you can be exposed to needle stick injury. You can be exposed to waste that comes from individuals' secretions, and then you are exposed, bound to have hepatitis and the like. So we want to protect our health workers.
All right.
We don't want them to be exposed. Communities, scavengers and the like, children could easily be exposed. We don't want them to be exposed to switch. That's why we're taking care of all these things.
Very well.
So we have the 2 machines, and then we one is placed, the bigger one is the one at Farato.
Okay.
And then the 75 series is the one at Edward Francis Small Teaching Hospital. The one at Farato will take care of all the councils and also the 2 regions. That is the Western 1 and Western 2. All facilities within that area, waste will be collected and treated.
Very well. I mean, good point there, Director. But let me just come back to the PS before I move on to the focal person there. Because this year, we've traveled a lot across the country, visited a lot of ministries and departments, including that of health. And we are also aware of the fact that there's a whole lot of infrastructural projects ongoing as we speak, and I've seen them. But one thing we've realized during our conversations and during our observation is that the shortage in support staff, you know, you have these new facilities and a lot of refurbishment ongoing, but then you need people to be able to maintain these infrastructure, you know, we're seeing. So talk to us about how you expect that this will be improved in this very complex facility we're about to see that will need a lot of support staff and proper maintenance so that all the amount of money that will be injected into it will not have to go into waste.
Yeah,
yes, I'll come back to you. Yes, just a moment.
Thank you, Farato. We also have our personnel plan, right? And we also have our various teaching schools. So we've assessed all the needs in terms of staffing that we need towards the end of construction work, and they're being provided training at the various training schools that we have, the School of Nursing, School of Public Health, and all the schools. So the personnel are being prepared, trained and prepared, ready for service delivery. All right, and we've also done a real assessment of all the core components of staff that we need in terms of doctors, in terms of nurses, and we're working towards it. We have a master plan, right? The master plan for this emergency National Emergency Facility is costed. The first phase, the second, up to the third phase of it are all costed. We're fortunate that we have a doctor as a minister and a surgeon par excellence who actually knows the direction he wants and the vision in which we are all buying into his vision to ensure that we move the health sector to another level, really different for the Gambians.
Very well.
All right.
Let me come back to you. Yes, you wanted to add on to that.
Yes, you were asking about whether the personnel is needed to occupy this bed. Currently, we are training about 38 midwife at the University of the Gambia, fully sponsored. And we are also training about 30 anesthetic, BSc in anesthetic in the University of the Gambia. It's only fully funded. This is all because of we have seen what will be the impact if we don't capacitize our people to meet the demand. And currently we already sponsor through the support from UNFPA to train about 200 CHN nurses and 200 SCN nurses. And we are also, currently, we are also training, extra training for our doctors. They are now into their residency program to become consultants. The training has already started more than 3 years ago because of the vision we have. Because we cannot be having all these areas and we don't have highly specialized people to man.
So training all these young healthcare workers, the possibilities of injecting them into the system, is that certain?
Yes.
The possibility is certain?
It's started. Because you cannot build structures just to be white elephant. That's why in order for us to capacitize to meet the demand, if you build a structure, you need people to service. That's why we have to build, at the same time we are training.
Yeah.
So within the next 2 years, before the completion of the center, the one-stop center, obviously the demand would have been met.
Okay, we hope so, and not just the one-stop center also, but other facilities that are around, because I put this to you since you're responsible for admin, and I'm sure you would be aware of some of these things.
The intention from the minister, each community will identify from the community people to be trained as nurses to go back and serve in the communities. That will meet the demand of primary health care.
And I was going to come to that and to direct that to Jendak, who is the regional director. She's the regional director, Western Region 2, you call it. And just tell us, because we know that in the NDP, decentralizing healthcare, especially that of primary healthcare, is very much crucial. How do you receive the news of having a facility like this in your region there, which is going to be in Farato? And just how will it alleviate the healthcare needs of the people there?
Thank you, Farato, and good evening, viewers. I am indeed pleased to be part of this process, as this is the first of its kind, especially in West Coast region. And looking at West Coast region, the distance, the communities, like the regions, it starts from the Fonyis, that is around Kalaji, extending down to Gunjur. And our referral point is at EFSTH.
Okay, from West Coast all the way to Banjul.
All the way to Banjul.
Okay.
And we know that in terms of emergency, any minute that you waste could cost a life. And having this particular emergency treatment center in Farato, it is more of bringing health services closer to the communities, and also improving the quality of health services to the people we serving. So as a regional health director, I would like to say I am really pleased to have this national emergency treatment center in the region, as it is going to improve our referral, let me say referrals. The referral point will be closer to our facilities, like Birkama is is more of a referral point for the minor health centers, and Birkama will refer to EFSTH. Now Birkama will only have to refer to the emergency treatment center.
Okay. I mean that makes sense. Let me just come to the focal person there, because you're also from the community, and I'm sure you've also witnessed firsthand how it feels, not having easy access to these facilities. But talk to us about your involvement in the project and what role you're going to play in this, in just making sure that there is, much sustenance and we mentioned maintenance as well. It's very much important that the public or the community members also are very much conscious of this as well. Talk to us about your role and just how eager you are to bring that forward.
Thank you very much, Farato, and good evening, viewers. The project, as the DPS has just mentioned, is just timely, and the community as the beneficiaries, it was important to incorporate us in the implementation of the project. We were trained as focal points as our role in the project. We were trained about the gender-based violence, sexual harassment, early marriage.
Okay.
Because the project staffs, they will live with us, and the contractor, there will be so many people at the project site working at the project site, and they will be staying with us in the community. So it is important to involve the community so that we know our role in the project, and where problems arise, how to solve those problems. This is why we were trained and as focal points, how to take care of those problems and where to report those problems.
Okay.
This is why these numbers like 1313 and 1025 came up, and so that wherever we see something going wrong, then we will report the matter to these numbers, and then we will also sensitize our community, especially the women who will be going there to work or to sell, and the kids also, because as the child labor, we also were also trained about child labor.
Okay.
Okay, we are trained that no child should be used or should be allowed to work who is underage.
Okay.
Because in law, that is termed as a child
labor. So I think
exactly.
it's more of like a vigilante group. You're also doing a surveillance mechanism
exactly.
in these communities as well. So it's like a cross-cutting, a coordinating mechanism you have in improving all these facets.
We have, for the first time,
yes,
the health ministry is selling it out, and we want all the other ministries to follow suit and go into the...
I was going to say that, yes, you are a social welfare person, so
right.
I like the component.
So what we have is we have the social impact,
yes,
and the social component, bringing in gender-based violence to the world of works, where we will very much address issues of GBV, sexual exploitation, child labor. It's all it happens to mitigate social risk in the project.
Okay.
And this is the first time it's happening. We've ensured that all the contractors that we engage, the consultants, their laborers, have signed a code of conduct.
Very good.
This is the first time it's happening, and I'm selling it out. That let all ministers follow Ministry of Health in the world of works to ensure that we strengthen the communities. And that's why we have 20 focal persons within that area, because it's almost $22 million project. So quite a lot of people will be coming across the borders within different communities, coming into the Farato community to work, right? And we need to ensure that the Farato community are also aware. So all the alcalos are involved, the community members. So we've been doing community consultations as well within the community. We've also done consultation with the vulnerable groups, the disabled, the elderly, and also the community leaders on the social risk that are likely to come and how they will mitigate it. And we also we have a team ready to respond to their issues when they call the 1313 number or they call the 1025 number. We have a grievance redress mechanism also within the project.
Right.
So it shows that we have taken the social part of it. And interesting part too, we've also given social support to the hawkers that were in that facility, that we are working there, the women and men that have their guardians there. We have resettled them, right? We've resettled all of them, though the land is not theirs, but we feel that is where they have their livelihood, right? And the Ministry of Health was keen with the support of World Bank to ensure that we resettle them. We've given them their resettlement package. They've all received their monies. They've also been trained on business management, on bookkeeping as well. And the most interesting part of it also, the women within the group that have been resettled have also been given livelihood restoration package.
This is nice.
All right. Then we have the vulnerables within those families, the elderly that we found within these families have also been given support. Then in the line of COVID-19, this COVID is still around. We've given all of them buckets, sanitizers, to ensure that they protect themselves from COVID. So we are taking it as a whole. And that's why I'm selling it to the other ministries, that they follow Ministry of Health and come to gender.
Indeed, it's a whole package I see here, because I know you're so passionate about gender and inclusion, but I also had a question on that and just, how the project is so reflective of this and also disability factors, looking at the complex as well, the medical complex to be precise as well. How reflective is it of this? Let me just come back to you, Deputy Director, to just briefly talk on that. Your mic, please. Yes.
Yes. To about the disabilities or
disability and gender issues, or maybe PS.
No, PS, for gender, PS will talk about that one.
Disability. Yes, I know you get so passionate about it, but
and that is why I brought it into the work, and I brought it into the health and selling it out to the other ministries in country to do that, because they all have a maintenance work being done and all this. They can copy from health. We are free to give it out. Now, as it comes to the issue of disability, we ensure that all the facilities, the construction works have ramps. Right. We've also the gender bit we've discussed to ensure that even the workers are aware of the need to protect, right? Not only the women, but the men as well, and the children. And we said 0 to child labor. We've also educated, given them sensitization, and we continue to do that. That's why we have the focal persons who are continuing now within the community to do community engagement, sensitize them.
And even the facilities in the complex as well. They should really cater for these dynamics.
In fact, I guess the director will tell you that we've trained all our nurses across the board. Right? Not only for the Farato facility coming up, but all the other facilities around Farato on GBV, sexual exploitation, sexual harassment, and we're also ensuring that they use the grievance redress mechanism, and these systems are all there to give it what it needs. And the project is very gender focused, because as doctor says, when you talk about issues of cancer, majority of the cancer patients are women. The breast cancer issues are getting high. The cancer center will address that. Mammogram we've already got now in country. It's already here. So really, that's the direction. That's the direction we're going.
Very well.
And we've been very gender sensitive as it comes to that, and we will continue to be so.
Certainly. We'll just put a hold to that and go on a short break. When we come back, we look at the laying of the foundation stone, the ceremony itself, and just what we can expect from this very complex we're discussing here, right here on GRTS. Stay with us.
The traditional way of describing a place to somebody who wants to come to your house is to say, when you reach that corner, you'll see a tree.
Stop at the arch.
John, I think you should move this way.
And then when you go further, there's a woman selling bananas under another tree.
No, go back.
Come to the next junction.
Left, right,
turn to your right, turn to your left.
Destination is on your right.
So it's a very poor way of trying to reach where you are going. It's very difficult.
The Gambia is located along the west coast of Africa. Our agenda is to use the plus code system across the country to help spur economic development and also transform the way we do businesses and the way we deliver services. Until recently, there was no addressing system in the country, and this was extremely very frustrating to know where to deliver specific goods on time with efficiency and speed. So the role that Google Plus Code will play in the Gambia cannot be overemphasized. We have finalized the implementation of the project in the capital city, Banjul, and the program has brought in great dividend.
Plus codes, they are digital addresses that will simply able one to find the address even with Google and so. The importance of plus code is really too much. The ambulance services, for example, the ambulance now can easily locate someone in Banjul, and Banjulians now can have the plus codes when they deal with e-commerce. So government is benefiting, the people are benefiting, and we are happy.
Now, for me, it's not very, very difficult for us to maneuver around Banjul. My brother came from the US, so he came to visit me. So I gave him the Google Plus address, and he used the Google Plus address to come to my house without any disturbance, without any distractions. And also I have a delivery that they deliver to my house. That before I cannot do, because before if I have anything that comes, I have to go myself to pick it. But I am able to do it now. It makes business easy. It makes movements easy. And people
Welcome back. We're still talking about the state-of-the-art medical complex, which is going to, the foundation of which will be laid tomorrow, December, there at Farato Farm site. And we still have officials from the Ministry of Health to really look at this facility and what we can expect from its services. But joining us right now is Ajiami Jata, a community focal person over there. And we also have Hadindao here, also a community focal person in this project, as well as Lamin Sambu, Health Communications Officer there at the Ministry of Health. And just before I come to them briefly, Director, just tell us what COVID-19 measures do you have in place? Because as we're moving, we're growing with COVID, we're seeing a mutating virus every single day. We cannot predict what shape it might take again. So it means we'll live with this for a very long time. Is this something you're factoring in this facility?
Yeah, absolutely. With regard to the program itself, that is this foundation laying tomorrow, we advising everybody that COVID-19 is still around, despite we have reduction in the number of cases. But nonetheless, we're going to have a gathering, and this is health event. So we advising everybody, we're going to have the public health officers on the ground. And the COVID-19 preventive measures are still going to be enforced. That is, everybody have to be in mask, but don't worry, if you don't have, when you come at the entrance, a mask will be handed to you.
You mean that's on the day of the ceremony?
On the day of the ceremony.
Okay.
Equally, we have hand sanitizers. People have to be, definitely, that has to go on. That's part of the personal hygiene. And also the seating arrangement too will be factored.
Okay.
No, because we don't want to be making the place as a source of infection.
All right.
Because we have the Omicron. That's the new virus. But it's not in the Gambia yet. Thank you.
Certainly. I'll come back to the ceremony, but let me just stick to the focal persons a little bit, and just maybe Lamin Sambu, the Health Communication Officer, because as someone mentioned, you have a grievance mechanism, and just tell us the role you play in a project like this, and just how you're going to go about addressing some of these, and just the timely acceptance of these complaints, and how you're going to relay it back to, to the officials for a redress.
Okay, thank you so much for that question. Actually, GRM is something that is almost new in this country, I would say. Usually, before World Bank implements any of their projects, they will want to do a GRM, and the meaning of GRM means a grievance redress mechanism. We all know that projects, come with their benefits, but also, they may come with certain challenges, and these challenges may be experienced either by the beneficiaries or even the project staff. So the grievances that we anticipate may be related to land issues. They may be related to gender-based violence. They may also be related to maybe grievances that are experienced by workers, let's say late payments, or maybe human rights abuses, child rights issues, or also even beneficiaries may also suffer some grievances, especially gender-based violence, such as rape, such as sexual harassment, or such as child pregnancy, so on and so forth. So we want to ensure that the project runs smoothly without any of these challenges.
Okay.
And then we have been trying very well. We have conducted series of trainings. Before today, we've had so many community engagements with the people of Farato and the surroundings. Okay, and these trainings, we invited a lot of people who we think may be affected. We invited, the Gambia refugee community.
Okay.
We invited those with physical disabilities. We invited those, with vision problems. We invited women groups and youth groups, because these are the people that we think may suffer from, from any grievance that we are anticipating.
And you're willing to address these grievances as they come as soon as possible.
Absolutely. That is why, we have set up, three committees. The first committee is at the community level.
Okay.
The second committee is at the regional level, and the final one is at the national level. So these are all levels that will be there to address any grievance that may arise as a result of the project. Yes.
Let me just come to Aji Ami Jata, their community focal person. Because we were supposed to also talk in our local languages, I'll just give them the opportunity to do that. Yentami bokk ci community bi fofu nonu Farato te programme bi tamit yeen la mo gëna njëriñ wax ñu yeen ban façon taxawaay ngeen di jël pour seet ne ni ne ki lii bi l'hôpital bi ñoo ñëw samp fofu nonu jigéen yi especially ak ñoo xam ne tamit ñooy buddi feebar dem fofu ñu ngi si njëriñoo ba tam yeen tamit yéen a ngi make sure ne li si war in terms of just making sure ne facility bi mu gën a am doole ba pare yaaxu du si mën a am because community bi tamit ñi fadika am neen taxawaay bu mag si loolu noonu tamit yéen ban taxawaay ngeen si fas yéene jël.
waaw jërëjëf asalaamaaleykum maa ngi nuyu képp ku ñu seetaan taxawaay bu am solo la. lii da projet bi dafa nekk projet boo xam ne musta am Gambia. 1500 bed loolu musta am Gambia. te lopitaan bi nekk na lopitaan boo xam ne community bi dañ ci war a taxaw te ñun focal point si train nañ ñu ci fànn bu nekk nag train nañ ñu suñ diggante contracto si naka la ñoo demee ñoom bu ñu am coono ci community bi tamit ñoom bu ñu leen jox coono gender based violence bi train nañ ñu ko early marriage train nañ ñu ko rape cases si train nañ ñu ko parce que dañ gis ne rape cases bi 80% bi su dee 100 la 80% bi yëpp ci kër yi la dee nekk te after dañ ko dee def sutura ba nga xam ne li war a am du am te loolu nekk na loo xam ne am na solo ñu jàngal ñu ko pour ñu mun di nit ñi ñu xam ko lopitaan bi nag nekk na lopitaan boo xam ne li ci gën a neex mooy am na su paree wax nañ ne dina am laab léegi ne test yu bari dangaa génn ci biti di ko def ci suñ léebo country yi doo demati yëpp da nga koo am ci biir lopitaan bi te loolu dafa am solo trop man li ma am pour wax mooy ne Gambia government ak Ministry of Health li ñu war a def mooy gërëm leen sant leen ñaanal leen ci taxawaay bu rafet biñ taxaw nii.
Hadi yow tam nga nekk focal person foofu noonu yow tamit ba façon yëg nga yëg si programme bi ak tamit ban façon taxawaay nga fas yéene jël yow sa boppa nga nekk nit kenn ban façon taxawaay nga si jël yow tamit pour def si sa waal yaa Mike bang si waaw si lu gàtt rek waaw. ekkati ko waaw.
waaw man in passing. li ma si mun a li moo jël moo nekk comme train nañ ñu fi mu nekk ba pare.
waaw
train nañ ñu si noonu ba nga xam ne. comme problème yi ñoo daw ak yëpp. du ci am bu soobee yàlla.
very good
waaw
comme ça léegi am ngeen training bi. pour war si jël taxawaay. solo so since ñu ngi run out of time I'll just come back to you Fanta to DPS so just tell us briefly what we expect to see from the ceremony tomorrow and just the officials who will be present there to grace this and remind us how much money we expect to be injected in this program.
Fatu, we expect to inject over 22 million US dollars in terms of construction work for the first phase.
That's almost $1 billion.
Right. And then we also have readily available these funds, 6 million US dollars for equipment. So we're not only constructing, we are constructing and equipping as well.
Okay.
All right, so it will be ready to move. And now what we expect tomorrow, we're expecting the general public, everybody to come in.
Okay.
All right, this is the national event. And we all need the proper health care in our country. We'll be expecting His Excellency the President to do the laying of the foundation stone so that work starts in earnest. We hope that within 16 months, this first phase of the complex will be ready and fully equipped to serve the public.
Within 16 months.
Within
That's
16
like
months.
1 year, 4 months.
Yes, right.
Very much so. I mean, we're looking forward to it. We've run completely out of time, but GPS and your entire staff, thank you so much for being here with us, and we're looking forward to the inauguration. This was all we had time for on this edition of this panel on the state-of-the-art medical facility that is going to be inaugurated tomorrow at 10 a.m. there at the Farato farm site, actually, and the whole public is invited to be there. The president will be there to lay the foundation stone for this very unprecedented facility that we are about to see. Well, we hope that you'll join there as well. All the best, and this was all we had time for. Many thanks for watching.